When it comes to Brazilian Jiu-Jitsu, we place our bodies in many positions where joints, muscles, and tendons are consistently being stressed under pressure. Because BJJ is such a physical sport, injuries can happen over time from training and competition. One of the most common issues, especially when training in the gi, is the tennis elbow, also known as lateral epicondylitis or lateral elbow tendinosis. This pain is commonly caused by repetitive gripping, grabbing, and holding onto an opponent's sleeves, collars, lapels, or pants during training. The most common site of the pain is over the lateral aspect of the elbow, right over the common extensor tendon.
Hello everyone, my name is Serge and I'm a certified athletic trainer with experience in combat and tactical athletes. Today I want to talk to you about the most common overuse injury in Brazilian Jiu-Jitsu, especially when training gi. It's called tennis elbow or lateral epicondylitis. In this video I wanted to go over the anatomy of the muscles involved, the causes of the pain in BJJ, how to prevent it from occurring, and what to do once it happens, and how to self-manage it. I recommend that for the first time you watch this video fully to understand the reasoning behind all the exercises included in it. Also to understand the correct progression from one stage to another, and what not to do when your elbow is irritated. Once you feel comfortable with the material in this video, feel free to skip to any sections that you want to for the reference.
As it can be seen on this anatomy picture, the muscle most commonly associated with lateral elbow pain is the extensor carpi radialis brevis. Along with the extensor digitorum and extensor carpi ulnaris, these muscles help with wrist extension and provide stability during gripping, grabbing, and pulling movements. These muscles originate from the lateral epicondyle of the humerus through the common extensor tendon. Repetitive loading or overuse over time can overload this tendon, leading to irritation, degeneration, and pain.
As I mentioned earlier in the introduction to this video, in the sport of BJJ, we rely heavily on our grips to break posture of our opponent, to control angles, and to set up different types of submissions on our opponent.
During live training, we end up exposing our elbows to repeated stresses from all the gripping and holding to our opponent's gi, for example. So over time, that constant workload can overload the common extensor tendon that helps stabilize the wrist during gripping. In addition, if our upper back and shoulders are weak or our posture is poor, we can also develop muscular imbalances, where our forearms muscles are overworked while others become weak.
The most common imbalances that I see in BJJ are tight and overworked wrist flexors from constant gripping and holding, weak and underdeveloped wrist extensors and finger extensors, since not a lot of people are training them properly, and weak shoulder posture with weak shoulder stabilizer muscles. So over time, all these imbalances, they start putting more stress on the elbow, thus leading to the tennis elbow pain.
Think about it this way, and let's use this picture as an example. If the shoulder and upper back are weak or poorly positioned and not properly engaged during any type of pulling and gripping movements, the elbow often compensates. That means the elbow ends up doing work that should be shared by the upper back and posterior shoulders. Over time, the forearm muscles overload the tendon that stabilizes the wrist during pulling and gripping, eventually leading to irritation, inflammation, and pain. On the second image, you can see that all the muscles of the back and shoulders are engaging in addition to the elbow muscles, thus creating less stresses being placed on the elbow and leading to better mechanics, which in turn reduces unnecessary stress on the elbow and improve long-term results. For that reason, this program includes not only elbow exercises, but also upper back and shoulder stability and posture exercises that you should consider adding on top of your forearm and wrist exercises for optimal recovery and for better muscle balances and strength.
Okay, now let's talk prevention. Obviously, the best way to deal with the tennis elbow or lateral epicondylitis is not to let it get worse in the first place. In other words, don't ignore it. As soon as you start feeling any kind of pain in your elbows, start addressing it. And here are some recommendations that I have for you to prevent it from happening in the first place.
Train the finger extensors regularly. Most grapplers train grip strength constantly, but almost nobody trains the opposite muscles that open the hand, such as your finger extensors. Next, strengthen the wrist extensors. These muscles help stabilize the wrist while gripping and pulling. Maintain wrist and forearm flexibility. Tight forearms create extra tension at the tendon. Therefore, regular stretching before and after training is a must and should never be skipped. Improve shoulder posture, stability, mobility, and strength. Better shoulder mechanics often means less elbow stress during pulling and gripping movements, leading to more efficient movements and control over time.
Now, what to do if your pain has already started? Do you stop training altogether or do you just adjust the intensity of your training? It all depends how bad your pain is. You want to grade yourself on a scale of 0 to 10, where 0 stands for no pain at all, and 10 is the highest amount of pain you ever felt. So, for example, if your pain is around 4 or below, you can probably just modify the training intensity and just do some self care exercises. However, if your pain is 6 or above, it's probably a good idea to stop training altogether and seek further medical advice. And here's what to do to ensure that your elbow pain does not get worse over time.
For starters, reduce heavy gripping and intense sparring temporarily. Do more drilling instead of live rolling. Change your grips. Cycle your grips instead of squeezing constantly. Use efficient grips instead of maximum tension all the time. So, for example, use C grip holds or full hand grips instead of the typical fingertip holds on a gi. Do wrist and elbow warm ups before any light exercises that do not increase pain in the elbow. Use ice after training if it helps to reduce pain and irritation. Consider wearing KT tape or counterforce straps for decreasing discomfort during physical activities. Begin controlled strengthening exercises for the shoulders, forearms, wrists, and fingers, which will gradually reload the tendon over time, making it stronger and less painful. And most importantly, do not ignore pain and continue max gripping through it. This is how a small irritation becomes a long-term injury that can take a long time to heal.
One of the biggest mistakes athletes make is that they expect tendon injuries to heal as fast as muscle strains. They do not. Tendon injuries take much longer to heal due to poor blood supply, which limits the oxygen and nutrients needed for the repair. Therefore, patience and consistency during the self-care matter the most for lateral elbow pain. Here are some typical timelines that you can expect to see for the recovery of lateral elbow pain if done correctly and if there is no other issues present at the elbow.
Mild irritation usually takes 2 to 4 weeks if the aggravating activity is reduced early and self-care is started. Moderate tendinopathy, 6 to 10 weeks, can be reduced with proper tendon and muscle loading and proper progression. Chronic cases, 3 to 6 months, sometimes even longer, depending on how long symptoms were ignored.
Before we get into our self-care protocol, I just wanted to go over a few aids that you can use to assist yourself with controlling your pain and also to assist you with making all the self-care exercises a little bit more tolerable. One of the few things that you can do to reduce your pain is use KT tape. The benefits of using KT tape is pain reduction throughout the day. The KT tape lifts the skin away from the underlying tissue, thus creating space, and by doing so, reduces pressure over the pain receptors. At the same time, improves circulation for lymphatic drainage and promotes blood flow, which altogether reduce pain and inflammation.
I am a big fan of using KT Tape Pro, which has better adhesion to the skin and it stays on longer during hard exercise where there's a lot of sweating. One roll of 20 pre-cut pieces is about 20 to 21 bucks. I do not receive any money for promoting this tape, and the only reason I like to use this particular brand is because it is a good quality product, easily available in sports stores and pharmacies, and I've been using it for years on my patients with very good results. Once you properly apply the tape over your skin, you can expect the tape to stay on for 4 to 5 days. The idea is to wear the tape consistently over a few days so it can help you with controlling the pain and inflammation. As with everything in our life, there are some basic precautions for using the tape, and the main one is the skin allergies to adhesives. If you develop a rash or start itching, remove the tape right away. Best way to remove it is under a shower so it does not rip off your skin or any hairs that you might have left on the side of the taping. I usually shave the area where I apply the tape in order to make the tape stick better and to reduce the discomfort of pulling on your hair. And now let's take a look at a proper application of KT tape over your lateral elbow to help you with controlling pain and making you more comfortable while training and doing your self-care exercises. Okay, here we're actually going to tape the elbow. X marks the spot where the pain is. I will take the smaller piece of tape and I will apply the outside of the tape or the anchor without any tension on the skin. Then I'll pull the tape over the area of pain with about 25% tension, and once again the end of the tape will be placed on my skin without any tension. It's important that those anchor strips on both sides of the tape have no tension in them at all, so that the tape stays on permanently on your skin for the duration that you will wear it. I will take the other short strip of tape and do the same type of application going over the area of pain, creating a little X pattern. Once again, the anchors have no tension, the middle of the tape is stretched out to 25%, and then I will rub the tape with the backing paper to make sure it adheres to the skin. The last remaining piece of tape will be applied over the forearm without any tension. As before, start with the anchor. Apply the anchor directly over the distal triceps. Once the anchor is adhering to the skin, remove the backing paper and grab the other side of the tape. Bend your elbow slightly and pull the tape downwards over the site of pain and then along the muscle, making sure that you cover majority of the extensor carpi radialis brevis muscle. At the same time, bend your wrist downwards and apply the end of the tape on your skin. Wrap the entire tape with the backing paper to make sure it adheres properly to your skin and stays on for the next couple of days. Another inexpensive aid to control your pain while being active is an elbow counterforce strap. They can be purchased on Amazon, for example, and are relatively inexpensive. Just make sure you do your research and pick one that has good opinion and is durable and comfortable to wear. The elbow compression straps or counterforce braces allow you to take the pressure of the painful spot with the elbow movement and exercise. The strap transfers muscle contraction to the muscle instead of the injured tendon site, thus reducing pain. Can be worn for a few weeks to assist with pain management and to help with reducing pain during activities. Wear it tight but without cutting off your circulation. Also, don't wear the strap while you're sleeping, only during the day and while you're being active. Lastly, if you develop any kind of allergies from wearing the strap, make sure you remove it and stop using it. Using ice after training or exercise when you're sore is also beneficial since it helps with decreasing pain and reducing inflammation. However, there are a few precautions when using ice. First of all, always use some type of barrier between the ice pack and your skin to avoid any type of skin irritation or damage, especially if you're sensitive to cold. A thick paper towel or some type of cloth should be sufficient. Never ice for more than 20 minutes, and ensure you do not cut off blood circulation to your hand and fingers if wrapping the ice pack over your arm with an elastic wrap. If you start developing some type of numbness in your hand or fingers, make sure to stop icing, since you might be affecting your ulnar nerve. Also, if you're planning to ice more than once per day, make sure to give your skin at least 40 to 60 minutes in between icing sessions in order not to cause any damage to the skin from icing too much. With many tools for self-massage being on the market, Lacrosse ball is one of the cheapest and easiest to apply in my opinion. Using lacrosse ball for self-massage techniques over the forearm region is a great technique to release tension near your forearm and to prepare tissue for stretching and follow-up exercises. Using a lacrosse ball for self-myofascial release before stretching breaks down knots and adhesions, or trigger points, improves blood circulation, and enhances flexibility, allowing for a deeper, more effective stretch with less discomfort. This targeted, firm, and cost-effective method releases deep tissue tension and improves range of motion. I highly recommend using a lacrosse ball after you finish your training sessions when your forearm muscles are tight and overworked from gripping. So you can use it daily if needed, or every other day if you are sore from the lacrosse ball used the next day. 2 to 3 minute sessions over the forearm and triceps area should be enough. The sensation you should experience is something between discomfort and pleasure. If you're being in a lot of pain, reduce the pressure on the ball, and if you don't feel anything, increase it. Rolflex is another great self-massage tool that can be used effectively for the elbow pain and variety of other muscles. And it is especially useful for athletes that use their hands a lot, so BJJ and rock climbers will benefit from its use the most. I am not getting paid for promoting this tool, but I have been using it for some time and I absolutely love it. I feel that it has kept my elbows healthy over the years, as I have suffered from a really bad tennis elbow in the past. You can purchase this tool on Amazon.com, and it is around 80 bucks. So it is a little bit pricey, but in my opinion, worth the money for anyone that wants to keep their elbows healthy and continue training hard through the years. Following lacrosse ball or Rolflex self-massage, ideally you should stretch your forearms that you just worked on. These stretches should be done before and after your training sessions to provide the most relief and to improve your motion and tissue elasticity. As with any stretching, each stretch should be held for about 30 seconds minimum to a point of mild discomfort but never pain. In addition to your forearm and wrist stretching, you should also include some type of a warm-up for your forearms, elbows, and wrists. Here are some examples of exercises that you can do before training or before working out to loosen up your wrists and your elbows.
Okay, now that you have learned a little bit about the lateral elbow pain, what causes it, and what to do to prevent it, let's finally get into the self-care exercises that you can do to strengthen your muscles and prevent this pain from ever occurring. Let's start with phase one.
Phase 1. Pain reduction and load management. Takes about 2 weeks or so. The goal is to calm pain and reduce tendon overload without completely resting. During stage 1, reduce gripping in BJJ. Focus more on drills and lighter training. Limit live rolling, especially in gi where grips are heavily involved. And try to keep your pain below 4 out of 10 on a pain scale from 0 to 10. During this stage, try to use ice after exercise or training sessions if you're having pain. In addition, use KT tape for pain reduction. And if you're working out or doing any other physical activities, try using counter force elbow brace for pain reduction. Exercises to be done during phase 1. If you're having weakness or shoulder posture issues, this is where you should include your shoulder posture and stability work 3 to 4 times per week. And obviously, you will work on your elbow and forearm exercises daily if tolerated. The isometric exercises are the ones where your muscles are contracted against some type of resistance without changing the length of the muscle or tendon, and the affected joint does not move. We use isometrics during the first stage because they often reduce pain quickly while allowing safe tendon loading without further irritation to it. If doing exercises leaves you more sore the next day, try to do them every other day instead of daily. First exercise we start with is the isometric wrist extension. Here you will grab a light dumbbell and hold it in your hand without any type of movement. Try to work up to 45 seconds over time. You can start with 10 to 15 seconds in the beginning and work your way up. Next exercise is isometric forearm pronation. For this particular exercise, you can use a bar, dumbbell, or a hammer. The idea here is to find an angle where you can hold your hammer, bar, or dumbbell without experiencing any discomfort, and hold it for 45 seconds as before. For isometric band finger extension, you can just find any band around your house, put it around your fingers, and with the opposite hand, open up your fingers wide and hold that position for 45 seconds. As mentioned earlier, during this stage, you should also work on your shoulder strength and stability to improve your outcomes and recovery. Obviously, as long as you don't have any pre-existing conditions that would prevent you from doing so. Do not move on to the next stage of self-care until your pain is under control and actually starts reducing in intensity. Phase 2. Early tendon loading. This stage usually takes around 2 to 6 weeks. The goal of this stage is to begin rebuilding tendon capacity and resistance to physical stress. Continue with shoulder exercises if you started them in stage 1, at least 2 to 3 times per week. Perform elbow and forearm exercises 3 to 4 times per week as tolerated. Continue with stretching and lacrosse ball self-massage before and after exercises. And try to keep your pain below 3 on a scale from 0 to 10. You can also continue with icing after exercises if you're sore, but try to limit it as much as possible. Continue wearing KT tape for pain reduction, and try to wean off the counterforce elbow brace if possible. During this stage, we will concentrate on eccentric training, which becomes very important. Eccentric contraction means that the muscle lengthens while being under tension, and in this case, the lowering phase takes about 3 to 5 seconds. Eccentric exercise helps during this stage because it improves collateral remodeling, improves fiber alignment, increases load tolerance, reduces pain sensitivity, and improves neuromuscular contraction. Phase 2 exercises. Eccentric wrist extensions. Here you will help yourself raise the dumbbell up, and from the up position you will lower it down, taking about 5 seconds per repetition. Perform each repetition slowly with controlled movement. If you're experiencing any pain, reduce the weight and find the dumbbell that's comfortable for your forearm. As before with the previous exercise, assist yourself to raise the bar up and then in a slow controlled movement bring it down into full pronation. It should take you about 5 seconds per repetition. Aim to go through the full range of motion and stop before you experience any discomfort or pain. With eccentric band extension, open up your fingers with the opposing hand and then slowly bring your fingers together, taking 5 seconds for each repetition. Phase 3. Strength and endurance building. This stage can last anywhere from 6 to 12 weeks. The goal of this stage is preparing for real grappling demands. During this stage, continue with your shoulder exercises as in the past. Your elbow and forearm exercises will be done slowly throughout the full range of motion. Add a regular strength training routine. Continue with stretching and using lacrosse ball self-massage after all your exercises and specifically after BJJ training, and keep your pain below 1. For any type of rowing movements, pull downs or pull-ups, consider using a wrist strap, which will be very beneficial. It will reduce pain and discomfort in your elbow. Do not rush this process. Take your time and do not move into the next one until you're completely pain-free. In phase 3, we will perform all movements in a slow and controlled fashion. Here you engage your muscles both ways without any assistance from the opposing hand. Perform wrist extension exercises through a full range of motion without any discomfort. Normal full range of motion forearm pronation and supination, where you will move the bar from one side to the other. As with the previous exercises, control the weight that you're using and ensure that you do not experience any pain or discomfort with this particular movement. Normal band extensions, where you will engage your fingertips against the rubber band in both directions. In this stage, we're going to add a little bit more strength training exercises. The first exercise is a bicep curl with pronation and supination. Great exercise to strengthen your forearms and to work that eccentric tension on your wrist extensors on the way down. Next, we have a hammer curl exercise. This is just another variation of the bicep curl where you're really concentrating on a brachioradialis strength. Another good exercise to add during this stage is your fingertip push-ups on your knees. Great exercise to increase your wrist and finger strength and stability at the same time. Mentioned earlier wrist straps. You can use them for any type of pulling movements during your workouts, such as rows, deadlifts, or pull-ups. They will assist you with controlling the weight with reduced grip tension, therefore reducing elbow soreness or any increases in irritation. However, once you're pain-free with any of the pulling movements mentioned earlier, stop using the wrist straps so you don't become too dependent on them. During this stage, you can also add more shoulder stability and strengthening exercises, such as hanging scapular squeeze exercise, during which you will squeeze your shoulder blades down together and hold them for 1 to 2 seconds. This exercise is great for improving shoulder posture, stability, rotator cuff strength, spinal decompression, and increasing grip strength, which is so important in the sport of BJJ. Another great exercise that can be added at the end of phase 3 is hanging off the gi to strengthen your grip. It also will be a good way to test yourself before returning to full competition. Our last phase, phase 4, is return to full sports. It takes anywhere from 12 weeks to 16 weeks or longer. The goal of this stage is to return to full performance and training BJJ without a relapse. Basically, you do not want to have any more pain after you're done with this stage. During this stage, you want to continue with your shoulder, elbow, and forearm maintenance exercises, so do them about 3 times per week. Continue with stretching and using like Rose Bowl self-massage after all exercises and training sessions, and try to add more advanced exercises to your strength training routine, such as tolerated, so gi pull-ups, kettlebell rows, and etc. During this final phase, you want to return gradually to light rolling, harder gripping, and full lifting exercises. Try to increase your load slowly without any pain. Don't rush the final phase. Once you master your fingertip push-ups on your knees and you're able to do 20 repetitions for 3 to 4 sets, switch to regular push-ups on your toes. During this stage, you can also add your regular gi pull-ups, where you're actually doing pull-ups by holding onto your gi for repetitions. This is a great exercise to test your grip strength and to see if you have any pains during the movement. Here's an example of another great wrist exercise that you can do during stage 4 with a self-made wrist roller. The eccentric wrist extensions with a bar should be performed in phase 4. Start with lighter weights and work your way up to 12-14 repetitions over time without experiencing any pain. In this next section, you can see all the shoulder and posture exercises that I talked about earlier that you can add to your self-care routine for better outcomes. Do them as necessary. We will start with the chest stretch, which will hold for 30 to 45 seconds. And as you can see on the video, I'm using a traditional squat rack for that. You can also use an open doorway to perform this particular stretch. 2 variations, with arms down and with arms up, both held for 30 to 45 seconds. After stretching chest, we will lay down on the floor and perform prone shoulder isometric extensions. Basically, all you do is lean back, raise your arms, and hold them in the air for 5 seconds. In the beginning, when you're still having a lot of discomfort in your elbow, start only with your body weight. Over time, you can add some light dumbbells as you get stronger and you don't have a lot of pain in your elbow with holding the weights in your hands. Next exercise is shoulder isometric W holds. Similar concept where you raise your shoulders up, but now you squeeze your elbows towards your ribs. By doing so, you will engage your rhomboids and traps a lot more. You can also add weights over time, but as before, start with your own body weight. The third version of the isometric shoulder exercises is the Y hold exercise. In this exercise, you want to first squeeze your scapulas downwards before lifting your shoulders up off the ground. Start with the body weight first before adding any weights. This is a tough exercise for people that have tight shoulders, so start easy with it and stop if you have any pain in your shoulders. Next exercise is dumbbell external rotations exercise. Make sure that you start with a light dumbbell that you can control and stabilize your elbow by putting something underneath it, like a rolled up towel or some kind of foam. You can also do this exercise standing up with a band, but this particular version is pretty easy to do and you can pretty much do it anywhere with a light weight. Push-up plus exercise is a great exercise designed to strengthen serratus anterior muscle that wraps around your rib cage. This muscle is crucial when it comes to stabilizing your shoulder with any overhead arm movements. Start in a push-up position without bending your elbows, engage your core, and retract or squeeze your shoulder blades backwards, followed by protraction, where you move your shoulder blades away from the spine, as in rounding your back upwards. Start in kneeling or standing position with core engaged, with your thumb pointing towards your side. Squeeze your shoulder blades backwards and maintain them there throughout the whole movement. At the same time, start the diagonal abduction movement across your body as you turn the thumb so it points backwards at the end of the movement. Return to the start position in the opposite way. To increase shoulder flexibility and mobility, we'll start with the external rotation stretch. You want to lay on your back with the arm to be stretched at 90-90 position and with the opposite hand holding onto a broomstick or some type of PVC pipe. Press down on the arm to be stretched. The stretch will be felt in your pec and your shoulder. Increase internal rotation of your shoulder. Lay on the side of your body with your chin over the shoulder to be stretched to keep it from lifting off the ground during the stretch. While the arm is at 90-90 position, push down on your wrist with the opposite arm, aiming to bring the stretched arm towards the ground. This stretch is very sensitive, so start slowly and work your way into a deeper stretch over time. Never push through the pain on this stretch. The last part of this video demonstrates various stretches for your forearms, wrists, triceps, and shoulders that should be performed on a daily basis after training BJJ to prevent reoccurrence of the elbow pain. As with any other stretching, always hold each stretch to a point of mild discomfort but never pain. Remember, if you're not improving with self-care routine I have showed in this video, or your pain increases over time, make sure to get evaluated by a qualified medical professional and stop doing all the exercises that are causing you pain, especially if you're still training BJJ. Don't ignore the pain. Be patient, be consistent, and trust the process. Tendons can recover very well when loaded properly over time. If you enjoyed this video and want to learn more about other types of injuries in the sport of BJJ and how to prevent them, consider following me on a YouTube channel. Link is included in this video and in the video description. Also, if you have any questions about anything in this video or you just want to ask me something, feel free to comment below in the comments section. I hope you guys stay healthy and see you on the mats. Os.